We're at the Save a Child's Heart Children's Home. This is the home away from home for all the children that Save a Child's Heart brings to Israel from all around the world to undergo life-saving procedures here in Israel. This is the list of all the children currently in Israel. They're from different countries. We have children here today from Ethiopia, Zanzibar, Tanzania, Kenya, Rwanda, South Sudan, and the Palestinian Authority in Gaza. We have medical partners throughout the developing world that refer children to Israel for their procedures and then follow up after they return to their home countries to see how they're recovering from their surgery. Save a Child's Heart is an NGO. It's a non-governmental organization. This is a charity, and we are supported by donations raised in Israel and around the world.
I'm Mama Guy, I'm from South Sudan. We are waiting like 5 years to come here to Israel. We're not thinking one day we will come to Israel because we see it is far. But the government of Israel and the South Sudan, they make a relationship and they support us to come here for surgery and save our children. We are happy. He's okay because before when we came, he always sick. After 2 months, we go to hospital, we spend 1 week, 2 weeks, but now it's okay. He have 3 weeks now after surgery.
The medical activity of the organization takes place at the Wolfson Medical Center, which is a public governmental hospital. There's a full Israeli team who work for the hospital, who treat Israeli children as their day-to-day work, but also treat the Save a Child's Heart children from around the world voluntarily. This is, of course, reduces the price for us, for the organization, to bring the children that we need to Israel for their procedures, and that is what allows us to keep doing the humanitarian activity that we do. So this is the pediatric surgical department. Here in the different rooms we have hospitalized children from Israel and the Save a Child's Heart patients from the West Bank, from Gaza, from Africa, from all around the world. Every Tuesday we have a free clinic at the hospital at Wolfson Medical Center. 20-30 Palestinian children from Gaza and from the West Bank arrive every Tuesday to be examined by the Israeli medical team. When we need to invite a Palestinian child to Israel for examination or for admission, we submit a request from the Israeli authorities. The family submits a similar request from the Palestinian Authority, whether it's in Gaza or in the West Bank. Once the family receives the permit, they go into Israel to be admitted or to be examined. And children has been coming for years. Even in the very tense tensions, even when missiles went back and forth in both directions, despite the political situation and the tense situation around us, we are continuing our humanitarian work and we bring the children.
احنا جينا من غزة.
They came from Gaza.
أروى مريضة إلا منذ الولادة.
Arwa from birth she has a heart defect.
طلعنا أول ما طلعنا هانا جينا هان ما قبلوش يعملوا لها العملية إلا غير بعد 6 سنوات.
They came here.
غزة حولتنا على المقاصد مستشفى في القدس على المقاصد. حولتنا عملت أروى
Gaza
عملية.
transferred them to the Maqasid hospital that is in Jerusalem.
عملت عملية وعملت
She did the
كاسترة
first
في
surgery and the
المقاصد.
catheterization there.
بعدها ما رحناش حكونا ما فيش إلها عمليات بس أروى تعبت.
And then they
أروى
said that she
تعبت
don't
صار
have.
في زرق وصارت مفيش مجهود.
They say that Arwa cannot stay in the hospital in the Maqasid. They don't have what to do with she. She's still cyanotic and she's a blue baby. She was.
فحد مستشفى الرنتيسي حولنا لهون.
So they came here from the Rantisi hospital.
كنا حنعمل لها عدة كاسترات عملناها المرة اللي فاتت قبل شهرين.
She did a lot of cauterization to prepare to the big surgery.
والمرة هاي جايين على كاسترة.
And they came today for another cauterization to prepare her for the surgery. My name is Nicholas. I'm a pediatric nurse here in this hospital. The job here, I think it's so hard because we met here a lot of children with a heart defect, and they came for surgery, for catheterization without any families. Sometimes they have a group that they're coming like from Zanzibar, from Zambia, from Ethiopia. So they came in one group. And the group has a nurse. That the nurse from the country will stay with the patient here, with the boy, girl, whatever.
I'm from Ethiopia. I work in cardiac ICU, so I come with 8 patients for the surgery. Some has a parent, the rest doesn't have a mom.
In the list of doctors in training, so Dr. Lawawa is from Zambia and he's training with Save a Child's Heart at the moment. In addition to bringing the children to Israel, and in a way more important than bringing the children to Israel, we invest a lot in training. We bring medical team members from developing countries to train them in different fields of pediatric cardiac care so that they can go back to their home countries and treat their own children independently. We also send our teams a few times a year to screen, diagnose, locate the children that we can medically help, and they will come to Israel in the following year to receive their life-saving procedures.
And we're happy that we have this project of such Save a Child's Heart. A lot of children that came back home with a healthy heart now.
Go back to their home countries to live like any normal child, healthy lives.